This video is called PAGET'S Disease of the Bone by Steve Aynes. What is Paget's disease of the bone? Paget's disease of the bone causes bones to grow larger and weaker than normal. The disease may affect one or more bones, but does not spread from affected bones to other bones in the body. But most people have it in their pelvis, skull, spine, or leg bones. These bones may become misshapen and, because they are weaker than normal bones, can break more easily. Some people with Paget's disease feel pain in these bones too. How common is Paget's disease? Uncommon in people under the age of 40. Paget's disease grows more common with age. The condition is more common in people of Anglo-Saxon descent in certain geographical areas, including England, the United States, Australia, New Zealand, and Western Europe. It is not common in Scandinavia, China, Japan, or India. Is Paget's disease a form of arthritis? People with Paget's disease often have arthritis at the same time, but they are different diseases. Sometimes Paget's disease is confused with arthritis because the pain from Paget's disease may be located on the part of the bone closest to a joint. So it may feel a lot like the joint pain of arthritis. Paget's disease can cause arthritis over time when enlarged and misshapen bones put extra stress on nearby joints. Your doctor may use several tests to find out if you have Paget's disease. How did I get Paget's disease? Doctors are not sure what causes the disease. Some people have inherited Paget's disease, which means it runs in their family and was passed down by their parents. But most people do not have any relatives with Paget's disease. Doctors think a virus may also cause Paget's disease in some cases. They are studying different kinds of viruses to try to find ones that may cause the disease. What should I expect with my Paget's disease? Paget's disease does not affect everyone in the same way. Some people have a very mild case with few or no symptoms. Others have symptoms and complications. Pain is the most common symptom depending on which of your bones are affected by Paget's disease. You might have other symptoms and complications such as those listed below. Although rare, the most serious complications of Paget's disease is bone cancer. Can Paget's disease be treated? Yes, Paget's disease can be treated. Finding and treating Paget's disease early is best to prevent complications. The Food and Drug Administration, FDA, has approved several drugs to treat the disease. Doctors most often prescribe drugs called bisphosphonates. These help reduce bone pain and stop or slow down the progress of the disease. Will these drugs also help improve the complications I have from Paget's disease? The drugs may help prevent complications from starting or prevent them from getting worse, but they cannot correct problems that have already set in. In some cases, surgery can help. Your doctor can tell you if surgery might be a good idea for you. How will the doctor know if the drug I take is working? Your doctor will probably monitor your progress using two tests: an X-ray of your bones and a blood test to measure the level of a chemical called serum alkaline phosphatase, SAP, in your blood. The X-rays will show your doctor pictures of how your bones are healing. A decrease in the amount of SAP in your blood will tell your doctor that the disease is less active and you are getting better. What other symptoms and complications of Paget's disease are there? If you have Paget's disease in pelvis, you will have pain or arthritis in the hip joint. In your skull, you will have enlarged head, hearing loss, headaches, or balance issues. Spine, you will have curved spine, back pain, or damage to nerves, causing problems such as tingling and numbness. Leg, you will have bowed legs, pain or arthritis in the hip and knee joints. Do I need to go see a special doctor? What kind of doctors specialize in this disease? The doctor who diagnosed your Paget's disease may be a specialist in the disease. If not, he or she can refer you to someone who is. Doctors who are the most experienced in treating patients with Paget's disease are endocrinologists who treat hormonal and metabolic disorders, rheumatologists who treat joint and muscle disorders. Sometimes other doctors may be needed, such as orthopedist, neurologist, and ears, nose, and throat specialist. Your doctor will help you find the specialist you need. Will my children get this disease too? Paget's disease does not always run in families. However, research suggests that a close relative of someone with Paget's disease is 7 times more likely to develop the disease than someone without an affected relative. Finding and treating Paget's disease early is important, so some doctors recommend that children and siblings of a person with Paget's disease be tested for the disease every 2 to 3 years after the age of 40. Where can I go to get more information about Paget's disease of the bone? There are many good sources of information about Paget's disease. These include the National Institute of Health Osteoporosis and Related Bone Disease Resource Center, website www.bones.nih.gov, the National Institute of Arthritis and Musculoskeletal and Skin Diseases at www.niams.nih.gov, the National Library of Medicine, the National Institutes of Health, website www.nim.nih.gov, and also the Paget's Association website www.pagets.org.uk. Well, thank you for watching. If you like this video, please subscribe to my YouTube video channel at Steve Aynes Comedy, where I'm hoping I will have more videos like this as I try to raise awareness for Paget's disease of the bone. Thank you.